Hi, I'm Dr. Ben Carter, and today I want to talk with you about something that affects all of us, our heart health. You might not think about your heart much during the day, but it's working nonstop, keeping you alive by pumping blood and delivering oxygen to every part of your body. Keeping your heart healthy isn't just about avoiding serious illness. It means having more energy, feeling better, and living a longer, happier life. In this video, I'll share simple, practical steps you can take to protect your heart. We'll cover everything from what you eat, how you move, to managing stress, and even the role of medicine. So, let's get started on the path to a stronger, healthier heart. Part 2. Understand your heart and heart disease basics. Your heart is a strong muscle about the size of your fist. It works like a pump, pushing blood through a network of blood vessels called arteries and veins. This blood carries oxygen and nutrients that your body's cells need to work properly. Sometimes things can go wrong. Fat and cholesterol can build up inside your arteries, making them narrow or clogged. This condition is called atherosclerosis. When this happens, your heart has to work harder to pump blood. If a blood clot forms and blocks an artery, it can cause a heart attack, which damages the heart muscle. Some common terms you might hear are cholesterol, blood pressure, and arteries. Cholesterol is a type of fat in your blood. There are two main types: low-density lipoprotein, or bad cholesterol, and high-density lipoprotein, or good cholesterol. Bad cholesterol can build up in your arteries, while good cholesterol helps remove it. Blood pressure is the force of blood pushing against the walls of your arteries. If it stays too high for a long time, it can hurt your heart and arteries. The good news is that many heart problems can be prevented by healthy choices. Understanding how your heart works and what risks to watch for is the first step to protecting yourself.
Part 3. Nutrition for a healthy heart. What you eat plays a big role in your heart health. A heart-healthy diet means choosing foods that help keep your arteries clear and your blood pressure steady. Focus on eating plenty of fruits and vegetables. They are full of vitamins, minerals, and fiber, which help your heart work better. Whole grains like brown rice, oats, and whole wheat bread are better than white bread or refined grains because they have more nutrients and fiber. Lean proteins like chicken, fish, beans, and nuts are great choices. Fish like salmon and tuna have healthy fats called omega-3 fatty acids, which can lower your risk of heart disease. Try to avoid too much salt because salt can raise your blood pressure. Also, limit added sugars found in soda, candy, and many processed foods. Too much sugar can lead to weight gain and increase your risk of diabetes, which is hard on the heart. Be careful with fats. Not all fats are bad. Healthy fats, like those found in olive oil, nuts, and avocados, are good for your heart. But stay away from trans fats and limit saturated fats, which are often in fried and processed foods. These can raise your bad cholesterol. Lastly, watch your portion sizes. Eating too much of even healthy food can lead to weight gain, which puts extra strain on your heart. Part 4. Physical activity and exercise. Exercise is one of the best things you can do for your heart. When you move your body regularly, your heart muscle gets stronger and can pump blood more easily. Exercise also helps lower bad cholesterol, raise good cholesterol, and keep your blood pressure under control. The most important type of exercise for heart health is aerobic exercise. That means activities that get your heart beating faster and your breathing deeper, like walking, jogging, swimming, or biking. Aim for at least 150 minutes of moderate aerobic activity every week. That might sound like a lot, but you can break it up into smaller sessions, like 30 minutes, 5 days a week. Strength training, like lifting weights or using resistance bands, is also helpful. It builds muscle and supports your metabolism, which can help with weight control. Don't forget flexibility exercises, like stretching or yoga, to keep your body balanced and reduce injury risk. If you are just starting out or have any health concerns, talk with your doctor before you begin. The key is to find activities you enjoy so you can stick with them long term. Remember, any movement is better than none. Even small changes, like taking the stairs instead of the elevator or walking around during breaks, add up over time.
Part 5. Manage stress and mental health. You might not realize it, but stress can have a big impact on your heart. When you feel stressed, your body releases hormones like adrenaline and cortisol. These make your heart beat faster and your blood pressure rise. If stress stays high for a long time, it can wear down your heart and increase the risk of heart disease. That's why managing stress is important. One simple way to relax is by practicing deep breathing. Take slow, deep breaths in through your nose and out through your mouth. This helps calm your nervous system and lower your blood pressure. Meditation or mindfulness exercises are also helpful. Even just a few minutes a day can make a difference in how you handle stress. Don't forget about hobbies and activities that bring you joy, whether it's gardening, reading, or spending time with friends and family. These can recharge your mental energy and help your heart stay healthy. Sleep is another key factor. Your body needs enough rest to repair itself and keep your heart strong. Aim for 7 to 8 hours of good quality sleep every night. If you find stress or anxiety hard to manage, talk to a healthcare professional. Mental health is just as important as physical health for your heart. Part 6. Avoid smoking and limit alcohol. Smoking is one of the worst things you can do to your heart. The chemicals in cigarettes damage your arteries, making them narrow and stiff. This makes it harder for blood to flow, raising your risk of heart attack and stroke. Even if you smoke only a little, the damage adds up. The good news is that quitting smoking helps your heart almost right away. Within just a few weeks, your blood circulation improves and your risk of heart disease starts to drop. If you need help quitting, there are many programs, medications, and support groups that can make it easier. Alcohol can affect your heart in different ways. Drinking small amounts might be okay for some people, but drinking too much can raise your blood pressure and add extra calories, which leads to weight gain. Heavy drinking can also cause irregular heartbeats and weaken the heart muscle. The general guideline is to limit alcohol to 1 drink per day for women and up to 2 drinks per day for men. 1 drink means about 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. If you don't drink, there is no need to start. And if you do drink, keep it moderate and don't use alcohol to manage stress. Part 7. Know your numbers and regular checkups. One of the best ways to keep your heart healthy is to know your key health numbers and check them regularly. The main numbers to watch are your blood pressure, cholesterol levels, and blood sugar. Blood pressure measures how hard your blood pushes against your artery walls. Normal blood pressure is around 120/80 millimeters of mercury. If it stays higher than that, your heart has to work harder and can get damaged over time. Cholesterol is a type of fat in your blood. You want your total cholesterol to be under 200 milligrams per deciliter, with low levels of bad cholesterol and higher levels of good cholesterol. Blood sugar shows how much sugar is in your blood. High blood sugar over time can lead to diabetes, which increases your heart disease risk. Regular checkups with your doctor help keep track of these numbers. Your doctor might do blood tests or use an electrocardiogram or EKG to check your heart's electrical activity. You can also keep an eye on your heart health at home. Some people use blood pressure monitors or fitness trackers to stay informed. Remember, knowing your numbers gives you a clear picture of your heart health and helps catch problems early. Part 8. Medications and when they're needed. Sometimes, even with a healthy lifestyle, you might need medications to help protect your heart. Common heart medications include blood pressure medicines and statins. Blood pressure medicines help keep your blood pressure in a safe range. This lowers the strain on your heart and arteries. Statins are drugs that lower bad cholesterol, reducing the chance of clogged arteries. Some people need these medicines even if they feel fine. That is because heart disease can develop quietly, without symptoms, until it causes a problem like a heart attack. It is very important to take your medicines exactly as your doctor tells you. Do not stop or change doses without talking to your doctor first. If you have questions or side effects, always communicate openly with your healthcare provider. They can adjust your treatment to keep you safe and feeling your best. Taking medications when needed is a powerful way to keep your heart healthy for the long term.
Part 9. Lifestyle habits for long-term success. Keeping your heart healthy is not about quick fixes. It is about building good habits that last a lifetime. Small changes, made consistently, add up to big benefits. Start by setting realistic goals. Maybe you begin by adding 1 extra serving of vegetables to your meals or taking a 10-minute walk each day. Celebrate these wins. They matter. Avoid falling for fad diets or miracle cures. These often do more harm than good and are hard to maintain. Find support. Tell your family or friends about your heart health goals. Having someone to encourage you makes it easier to stay on track. Remember, life will have ups and downs. Some days you will do better than others. That is okay. What counts is that you keep going and never give up on your heart. Taking care of your heart is a journey, not a race. Every step forward makes your heart stronger and your life better. Part 10. Conclusion and call to action. To sum it all up, keeping your heart healthy means taking care of your body and mind every day. Eat nutritious foods, stay active, manage stress, avoid smoking, limit alcohol, and keep track of your health numbers. If needed, follow your doctor's advice and take medications as prescribed. Start with 1 small step today. Maybe take a short walk, add more veggies to your meal, or try a few deep breaths to relax. Every little change helps. Remember, heart health is a lifelong journey. The choices you make now can add years of quality life. If you found this video helpful, please subscribe to the channel for more easy health tips. Take care of your heart. It is the engine that keeps you going.
If you found this information about heart health helpful and want to learn more simple and important tips to maintain and improve your heart's function, subscribe to our channel. Here you will find practical advice, scientific explanations, and inspiration for a healthy lifestyle. Don't miss new videos. Take care of your heart together with us.